Most minor burns can be treated at home. They usually heal within a couple of weeks. For serious burns, after appropriate first aid and wound assessment, your treatment may involve medications, wound dressings, therapy and surgery. The goals of treatment are to control pain, remove dead tissue, prevent infection, reduce scarring risk and regain function. People with severe burns may require treatment at specialized burn centers. They may need skin grafts to cover large wounds. And they may need emotional support and months of follow-up care, such as physical therapy. Medical treatment. After you have received first aid for a major burn, your medical care may include medications and products that are intended to encourage healing. Water-based treatments. Your care team may use techniques such as ultrasound mist therapy to clean and stimulate the wound tissue. Fluids to prevent dehydration. You may need intravenous (IV) fluids to prevent dehydration and organ failure. Pain and anxiety medications. Healing burns can be incredibly painful. You may need morphine and anti-anxiety medications, particularly for dressing changes. Burn creams and ointments. If you are not being transferred to a burn center, your care team may select from a variety of topical products for wound healing, such as bacitracin and silver sulfadiazine (Silvadine). These help prevent infection and prepare the wound to close. Dressings. Your care team may also use various specialty wound dressings to prepare the wound to heal. If you are being transferred to a burn center, your wound will likely be covered in dry gauze only. Drugs that fight infection. If you develop an infection, you may need IV antibiotics. Tetanus shot. Your doctor might recommend a tetanus shot after a burn injury. Physical and occupational therapy. If the burned area is large, especially if it covers any joints, you may need physical therapy exercises. These can help stretch the skin so that the joints can remain flexible. Other types of exercises can improve muscle strength and coordination. And occupational therapy may help if you have difficulty doing your normal daily activities. Surgical and other procedures. You may need one or more of the following procedures. Breathing assistance. If you've been burned on the face or neck, your throat may swell shut. If that appears likely, your doctor may insert a tube down your windpipe (trachea) to keep oxygen supplied to your lungs. Feeding tube. People with extensive burns or who are undernourished may need nutritional support. Your doctor may thread a feeding tube through your nose to your stomach. Easing blood flow around the wound. If a burn scab (eschar) goes completely around a limb, it can tighten and cut off the blood circulation. An eschar that goes completely around the chest can make it difficult to breathe. Your doctor may cut the eschar to relieve this pressure. Skin grafts. A skin graft is a surgical procedure in which sections of your own healthy skin are used to replace the scar tissue caused by deep burns. Donor skin from deceased donors or pigs can be used as a temporary solution. Plastic surgery. Plastic surgery reconstruction can improve the appearance of burn scars and increase the flexibility of joints affected by scarring. Lifestyle and home remedies. To treat minor burns, follow these steps. Cool the burn. Hold the burned area under cool, not cold, running water or apply a cool, wet compress until the pain eases. Don't use ice. Putting ice directly on a burn can cause further damage to the tissue. Remove rings or other tight items. Try to do this quickly and gently, before the burned area swells. Don't break blisters. Fluid-filled blisters protect against infection. If a blister breaks, clean the area with water, mild soap is optional. Apply an antibiotic ointment. But if a rash appears, stop using the ointment. Apply lotion. Once a burn is completely cooled, apply a lotion, such as one that contains aloe vera or a moisturizer. This helps prevent drying and provides relief. Bandage the burn. Cover the burn with a sterile gauze bandage, not fluffy cotton. Wrap it loosely to avoid putting pressure on burned skin. Bandaging keeps air off the area, reduces pain and protects blistered skin. Take a pain reliever. Over-the-counter medications, such as ibuprofen, Advil, Motrin IB, others, naproxen sodium, Aleve or acetaminophen, Tylenol, others, can help relieve pain. Consider a tetanus shot. Make sure that your tetanus booster is up to date. Doctors recommend that people get a tetanus shot at least every 10 years. Whether your burn was minor or serious, use sunscreen and moisturizer regularly once the wound is healed. Coping and support. Coping with a serious burn injury can be a challenge, especially if it covers large areas of your body or is in places readily seen by other people, such as your face or hands. Potential scarring, reduced mobility and possible surgeries add to the burden. Consider joining a support group of other people who have had serious burns and know what you're going through. You may find comfort in sharing your experience and struggles and meeting people who face similar challenges. Ask your doctor for information on support groups in your area or online.